Okay, perfect. Hello, everybody. I'm Karen. This is Scott, Gus, and Lucas, and we're Team 4, and we created AdvocateGPT, which is the doctor friend that you wish you had at all hours of the day that you could call. So the pain point we're tackling is when you get a really scary diagnosis. You come out of a meeting with your oncologist, and you hear that you have cancer. We've talked to a lot of patients and read patient testimonials, and we've heard that most people just completely black out in that meeting, and they have no idea what happens. They walk out with a stack of paper, a long after visit summary, longer than a CVS receipt, and a ton of other handouts, and they have no idea what is going on and no idea what just happened during the meeting. To bring this to life, we've created a character, John, and John is here with us today. He's been just diagnosed with stage 4 lung cancer. He's got all the documents. John, tell us how it feels.
I left that appointment completely numb. I couldn't remember half of what the doctor said. And now I have a 30-page packet full of medical terms I don't understand. I don't even know how I'm going to tell my family. There's all these appointments to schedule and meds to start, but I just want someone to break it down for me and tell me what I'm supposed to do today.
So we built that. We built a buddy for John so that he can automatically have somebody to talk to and figure out what does he need to do in the next 24 hours. Forget thinking about the next week or the next few months, just what do I need to do to take care of myself today. So this is John's EMR. His provider uses Canvas, and he got this long document that you can see here, which is like a horribly long ABS, as many of you guys have seen. And then he'll be prompted to go to AdvocateGPT, which is already built into Canvas, and he'll have a chatbot named Alan, after Alan Turing, who will be his digital care advocate. Alan knows everything about John's ABS. Alan knows John's medical history. We've built it with all the FHIR rails, and has created for him a 24-hour summary of all the things that he needs to do. The 3 categories are the meds he has to take. You can click through those and mark those as taken, like a checklist for him, and referrals that he can schedule. And we've built in buttons that you can automatically schedule follow-up appointments. So here, Gus just clicked on the schedule button. We've prompted Alan to help him schedule an appointment. And so while Alan works, he's going to go into the EMR, check when that doctor is available, and immediately schedule an appointment for him.
And we're doing it live.
We are doing it live. So now this appointment has been scheduled. And if you go to the Appointments tab, an appointment is there, right in the EMR. We also have symptoms to watch out for. A lot of doctors will get calls about things that are not super urgent just because the patient is panicking. So we've listed out specific symptoms that he should be looking out for to go out for after. We've also implemented a way to really just ask questions in your language of, I've vomited a bunch of times. Is that normal? And the advocate is meant to help you deal with those types of questions in your own language, because we know most people don't understand medical jargon. So that is Care Advocate. And here he is, using Google's model to really pull medical advice that's validated and clinically correct.
Woo! Woo!